All right, we're good to go, folks. Thank you for your patience.
Dr. Lombardi, I'll get me out of the way first, if you don't mind. First, there's been a lot of questions about the mask mandate and what that will mean for athletes. Can you clarify what the board is looking for you all to do? Are you petitioning lawmakers? And also, how will that apply to sports like swimming, I think is the one that comes up the most.
The board action this afternoon was to follow the order of the Department of Health and instruct schools to consult with their individual school solicitor to see if they comply with an exception under Section 3A and 4C of the order. So that was the board action today.
What do you think are some of the concerns for the PIAA when it comes to the mask order? Where are you guys most concerned with what the health secretary has recommended?
Well, from what the board said today, it's to be an individual assessment by a local school so they can make their own determination. But our sport medicine committee is very concerned just because of pre-existing exercise-induced asthma conditions or possibly getting good breathing oxygenation while participating, as well as possibly the retainment of CO2. And then there's always the possibility if it's inside where a mask comes off, someone could step on it, slip. So there's concerns there. But today's board action said each individual school needs to make their own decision.
As it's written right now, we could see schools competing in fall state championships with their athletes required to wear masks. Is that the correct understanding?
If their schools decide so, yes.
Also, there was a little bit of confusion about virtual meets and what those look like. Does that mean that, like a swim team, for example, one school would compete in their own pool, another school would compete in their pool, and then like swap times? Is that how that goes?
Yeah, I'll turn you over to the swimming expert to take care of that. And I think she'll give you a good, solid stroke answer.
Yeah, Allie, that's pretty much exactly how we see it happening. National Federation has actually already come out with guidelines for virtual swim and dive meets. So we'll follow those. We'll also seek some further guidance for the other sports. But we will be asking and requiring an official to be at those respective pools so that we have an official times recorded. And then, like in swimming and diving, we would use a program called Meet Manager to merge those together and determine results.
Melissa, is that then how all swim meets are going to be run, all gymnastic meets, or will there be opportunities for teams to meet in the?
Yeah, that'll all be local based decisions. So if the schools in the local leagues feel that that's in their best interest to do that, then they can do it. But maybe some areas want to still have in-person meets. So it will probably be as you've seen in the fall, different parts of the states might be doing something different.
Bob, also, could you clarify what the 3-day consecutive practice, where we ended up with that? There was a lot of discussion, but I'm a little shaky on where we ended up.
It was defeated, and the board directed the executive staff to come back with a proposal at the next board meeting, which will be December 9th, to address the issue of temporary school closures in practice.
So what is it written as right now for the next couple of weeks?
There is none. It was defeated.
So there's no requirement for consecutive days of practice?
It specifically goes back to the language that refers to school strikes.
Thank you.
Bob and Melissa, Chris Arlen here, in the last 24 hours, have you tried to reach out, I assume, to the governor's office to get some clarity on this? And what kind of feedback have you received from the governor's administration on the mask mandate?
Yes, we did, and none.
Any type of feedback you've received from them?
Yeah, I answered that. None. Sorry, Chris.
Okay. What advice then will you guys give to officials, game officials, because that is under your jurisdiction in terms of officials? What will you tell them? Because you know, especially guys who use whistles, it's kind of tough to use a whistle for a basketball game if you're wearing a mask.
Well, obviously, we're not going to play till minimally 3 weeks, so we have some time with that. We do have some guidance in our guidelines for sports officials that are posted on our website, and right now that's what we're going to follow. Obviously, the order says that people involved in competition need to wear masks, so we're going to follow that to the best of our ability and see how it will impact those guidelines, and we need to adjust them and bring them back because we will have another board meeting before competition is able to start.
Bob, Mike White, you said there the school solicitors and the schools get with their solicitors to see if they comply with a possible exception to this mask rule. What would be an exception? I don't know those things, or what are an exceptions?
I think the one section, Mike, I believe it's 3A, that says if wearing a mask would create an unsafe condition, then maybe the school solicitor could take a look at that. They also could look at the health condition of an individual athlete. If an athlete has some type of health condition, like respiratory or activity-induced asthma, that may provide for an exception. So we could see individual kids, maybe even on a team, some students may be wearing them, some may not. But the board felt that this assessment should be done by each local school because they have not only their own health and safety plans, they know the conditions of their students by the virtue of their completion of the SIPI form for them to play athletics. So that they, with their medical team at the local school, could not only make team, but also individual athlete assessments.
So Bob, this weekend, football games and soccer games, those athletes, unless their school decides, those athletes will have to wear masks?
If their school decides that they may fit into an exception, otherwise the order and the Q&A put out appears to say that in competition they're to be wearing them. We have reached out for clarification, but that's the language that's out on the website.
What will the officials be doing this weekend then for field hockey, soccer, football? Will they be required to wear a mask?
Allie, according to the order, our people will be masked like they have been in a lot of games. Some games they chose not to, but for this weekend we'll be in masks unless one of the officials may have a condition that alleviates.
Bob, obviously there are a lot of teams that had to drop out of the playoff brackets throughout both district and state levels. Do you think, has that given you guys any uneasiness to kind of the way the playoffs are set up, or do you think it's just sort of a reality of the situation we're in right now?
Dan, I thought I only counted 6 out of 96 teams in football that may have dropped out, starting with district play. Now, I think it'll get all the way back to the individual start of districts, but I thought I counted 6 out of 96. I don't think that's a lot. But obviously everybody is keeping an eye on the changes here in the last couple weeks. And I think with an abundance of caution, I think the Sport Medicine Committee said that people need to continually evaluate their local situation and what's going on at their schools to see how we can proceed with the start of winter season. I think with winter season, there's some good things. You have smaller number of contestants involved. You can put them in a bubble, so to speak, and you can handle direct sanitization a little bit easier than an outdoor event that's more spread out. But opposite that, the biggest concern is indoor versus outdoor with, the airflow and those type of things. So I think our schools did a terrific job in the fall. They ought to be complimented that we even are as far as we are, that we're 10 days away of completing a fall season, where we're very, very proud of that, because I think many of our schools were very concerned about even starting in August, and I think they proved to their communities and to everyone that this can be done if it's taken seriously, which it was, and putting in proper protocols.
Melissa, hi, it's Joby. Sorry to bother you, but I'm still I guess I'm a little mind boggled. Allie asked about, are we expected to have swimmers compete wearing masks? I mean, that's the way it's written. I can't imagine we're going to have swimmers in the pool wearing masks.
Yeah, I would agree with you, Joby. I think we got a serious issue when it comes to swimming. So that is something, as Bob mentioned, we're definitely going to push for some clarification. I'm not sure that all the sports were thought out when that was put in there. So it's definitely something we're going to have to get some clarification on, because when you're talking about, a swimmer turning their head and grabbing oxygen in the pool, we could have some serious medical complications if we don't have, some type of an exemption for swimming. So yeah, I would say we're going to really seek some clarification on that one, Joby.
Okay, so we can expect, or at least some of the swimming coaches or athletic directors can expect some sort of a guidance from the PIAA, because practices are supposed to officially start Friday. I mean, I know it's a quick turnaround for you with this being thrown on your lap here, but they would expect some sort of release and statement and some guidance as they start practice, right?
Right. And I think that the same thing that we talked about in the section that Bob mentioned, if it causes an unsafe environment, which I believe you could apply when we're talking about swimming, that the school can make that determination as they're moving through practices if we don't get something to them before then.
Thank you, Melissa. I appreciate it.
Sure. You're welcome.
Bob Lombardi, Bob Greenberg, how you doing?
Good, Bob.
Can you clarify the part about wrestling and the 8-person maximum tournament bracket? Is that just for the regular season, or is that for the postseason as well?
That was a comment from our sport medicine committee, that they don't think getting anyone together of 8 or more, whether it be an 18 duel or an 8-person individual bracket, whether it be regular season or postseason, is in our best interest. That was a recommendation from them. We have not made any final determination on postseason at this time. Matter of fact, we've just started the conversation with that. We tried to get through the fall sports season before we tried to tackle winter. So that's to be determined.
Okay, thank you for that clarification.
You're welcome. Nice to talk to you.
You too, Bob.
Well, Bob, that wrestling thing with the 8 in a tournament is passed. I know it was a recommendation, but that's a pass by the board, right?
Yes, right. Mike, the upshot of wrestling is there's really, and I think schools are taking this on their own, there's really a sentiment to keep things real conservative, where school A wrestles school B, period. And we don't have large gatherings, because that's the concern. So that's why I believe sport medicine talked about 8. The other piece with that, Mike, is for regular season duels, where I think sport medicine would like to see more of those, is that we wrestle maybe 6 bouts and take an intermission, sanitize the mats and everything, and then bring the other 7 kids in and wrestle the final weight classes that way. So that's a little bit of a change, a recommendation to use an intermission. Another suggestion that came out of Wrestling Steering Committee was possibly have 2 mats and put 6 on the first mat and then 13 on the next mat, and go back and forth, and when one's cleared, sanitize it and just alternate back and forth to try to keep optimum conditions. So there's some of the suggestions that you'll see in the guidelines. So that was all done with the eye on the idea of optimal guidelines to keep it safe.
Bob, could you go over real quick again the requirements for preseason practices for winter sports? How many you have to have before you can play a contest again? And is that one of the reasons why you guys want to go forth with winter sports, at least the start of them, is to get those practices in?
I'll try to take them in order. I think the first question was how many preseason practices? 15. It's 3 weeks of practice, 15 practices before the first contest. You must have 5 practices before you have your first scrimmage. I think that answered the first question. The second question, Mike, is it is our feeling that if schools are able, that they should try to start on the first practice day and get as many of their practices in as possible, because if they can get their 15 days of preseason in and be ready to start on the first weekend, whether they start or not is not the issue, because there might be an interruption in the season. But if you can get those 3 weeks in, then you only need, as of today, you only needed 3 more days to restart. That's up to discussion now at the next board meeting. So, but we still would like to see the preseason in, so that if there is an interruption, you still have almost 10 weeks of the season to get your 22 or 24 or whatever the number of competitions is. If you wait till, let's say, January 31st to start, well, you got to get 3 weeks of preseason in. Now that takes you about the 18th of February. You're only going to have 2 weeks to play. You can't play 22 games in 14 days. So what we're trying to do is get people to set the foundation so that if they do have a hiccup, you can adjust and adapt. And if we've learned anything from the fall, the people that started earlier were able to handle interruptions easier than those that started late, because they ran against time and they didn't have any room in the schedule. Does that make sense? And we haven't discussed postseason yet because we're trying to get it started, and now we're going to try to see what we need to do, whether we need, are we going to have a 32-team bracket in basketball? Or are we going to have all those qualifiers in swimming and wrestling? We are pretty sure we may be shortening those down, because if we learn from the fall as well, by having a champions-only tournament gave us the ability to get something in along with a good regular season, because the membership told us loud and clear, we don't want to stop at the end of the regular season if we can have a district and a state playoff. 10 of our 12 districts said loud and clear, we want to go as far as possible. So that's, that's pretty overwhelming. This school district, Philadelphia, obviously shut down, but the other schools of District 12 wanted to continue, and District 10 opted to stop at their district play, even though some of the communities now are a little disappointed in that, but that was the decision made, and we're good with that.
But Bob, we're also in a different boat than August, where the cases are spiking to record highs, stuff that we haven't seen in the 10 months of this pandemic. And, we're having indoor mandates change now from citywide, in Philly and also statewide. And, what we know about from epidemiologists and studies about indoor spread, and granted, even with masks, that's going to limit it a little bit, but it's not a guarantee. This is not comparable to August. So what concern is there from PIAA here about starting things up in a few weeks here?
I'm not sure your question, Jake.
What concern is there, with everything going on, with how widespread this virus is and how much it's rising right now across the state with deaths, or cases, hospitalizations, that this is the right move to start the season on time here right now? It seems like, at least to me, that this is getting a little ahead of ourselves.
Well, I think, Jake, that if you would refer to our sport medicine guidelines, our sport medicine committee was very clear on saying that proceeding with an abundance of caution, that they may start, and that since the impact, it varies from county to county, it should be balanced with the respect to the public interest in each community, as conditions for participation allow, and the belief that schools have strict adherence to their health and safety plans along with Department of Health and CDC guidance, we believe it provides a reasonably safe environment for participation. That is further supported by the fact that we have not learned of any school-to-school or team-to-team spread of the virus through athletics. We are not aware of any. And our sport medicine people, who have done extensive research, and some of them not only are writing the policies for their health systems, are not aware of any or have any research of such. So that's why that consensus statement was made.
Dr. Lombardi, just another question on the mask mandate. If we're leaving it up to individual schools, let's say school A says let's wear masks, school B says we're not wearing masks, and they're competing, how does the PIAA advise on what to do if one school has a mask policy and the other school does not? Wouldn't that create concerns in sports like wrestling, where the athletes are in close proximity?
That is a very good question, and we've had that in some of our events where one has worn and one has not, and it's gone quite well. You bring up a sport, as well as Joby did, which is a concern for all of us to wear a mask, because in wrestling as well as swimming, there's a health and safety factor. Getting that hand in that mask, in a grasp of a move, with torque on a neck is very, very serious. So we're concerned about that, and we hope to have some guidance from the Department of Health on those two sports. But as far as the other ones, that will be an individual school assessment, and hopefully we can continue to move in that direction.
Wouldn't the mask be the same as I don't know the technical term, but the headgear that wrestlers wear in terms of a safety concern for being able to twerk it, like you said, and get caught in it? Wouldn't it be a similar concern?
It is not. The headgear is a mandatory piece of equipment for wrestling that is secured safely to the head, and it is not something that is easily grasped.
I have never wrestled, so thank you.
And we're glad you haven't, Ally.
Hey, Dr. Lombardi, Tom Reisover, how you doing?
Good, Tom. Thank you.
I was wondering what you're hearing out of Montgomery County. There's a report that they're going to shut down sports next week, and you could have 3 football teams win this weekend and have to forfeit next week. What are you hearing out of that county?
Tom, I'm not aware of that comment. I do know With the situation with Philadelphia, I was informed that with one school that is in Philadelphia, they are not practicing or playing in the Philadelphia County, therefore they can continue to participate in our tournament. I'm not trying to assume anything, but I would think it may be similar for those other schools. I wouldn't be able to give you a final answer, Tom, because I'm not aware of that information.
Okay, I just saw a report. I think it was in the Philadelphia Inquirer. I think Upper Dublin, Souderton, and Bishop McDevitt are all in that county that could shut down and not have sports starting on Monday. So I wasn't sure if there's anything that could be done, or they're just going to play this weekend, or what the situation really is.
We have not had any information on that at this time. We will pursue it as we get closer if they do make that decision.
Okay, another question I had for you is regarding next weekend, the football championships. You know, with COVID and travel concerns, there's a possibility of 2 games, I think 5A and 1A being all Western. Is there a chance you guys consider a Western site, or will all 6 be at Hershey no matter what happens?
Right now, we're contractually obligated to Hershey. Right now, we're going to follow through with that as scheduled. It is also contracted on statewide TV to provide everybody that opportunity. So we will continue with the games at Hershey next weekend, regardless of who qualifies.
Thank you.
Hey Bob, can I just ask a follow-up on masks as well? And I apologize if I might have missed something on this previously. I was just curious if has sports medicine been able to look at the safety element of this when it comes to, I don't know, oxygen levels and stuff like that during competition? I know this is a pretty recent thing from the state, but have they looked at it from a safety point of view for doing these cardio type sports while wearing a mask?
Yes, they have, Dustin, and I'm not sure me making a comment that may not be consistent with what the Department of Health direction is, it helps anyone, so I'm just going to leave it where it is.
Fair enough.
I think you know where I'm coming from.
Sure.
Dr. Lombardi, Mike Drago, a question about the transfer rules. You appeared to have tweaked those somewhat today. What are the changes there?
Give me a minute, Mike, I'm sorry. The tweaks basically are many of the appeals that we have had for an in-season transfer or postseason eligibility. The appealing party, for the lack of a better term, comes in and wants to debate the 21-day sit-out. That's not waivable. So we wanted to take that off the table and codify it. The other 2 things that have come up repeatedly are the student has already been granted athletic eligibility, that the transfer was not athletically motivated, but because they're a junior or a senior or even a sophomore, they do not have postseason eligibility. People come in and try to make the argument that this wasn't an athletically motivated transfer. That's already been decided. We're trying to tell them that's off the table. The other thing they try to say is the student, this was out of the student's control because mom and dad decided. Mom and dad decided for Bob to go from ABC High School to DEF High School because there are legacy people there, or they think it's a better computer program, or they have a better chemistry department, or whatever. And mom and dad decided, therefore, this is out of the hands of the student. That doesn't fly because that is not a factor to be considered in in denying or requesting the waiver. Did that help you?
Yeah, these are more clarifications than changes.
Correct, based upon actual testimony and things that we're seeing that are maybe little tweaks to make it a little more seamless for people.
Thank you.
You're welcome.
Bob, this is Bob Grimberg again. In a previous meeting, you had talked about the potential of shifting the state football championship games around to prevent teams from having to travel on Thanksgiving. So did you say that the times you released today are just not in stone yet, that you could shift a game or two if necessary?
Yes, that's correct, Bob. There are tentative times. Obviously, we have, we got 24 teams left. So, if depending upon if someone makes a request, we'll take a look at it. You know how that is. Sometimes there's a ripple effect that you can't do certain things, but we were going to make our best efforts to try to accommodate somebody if there is something that could be worked out. We wanted to keep flexibility for the games.
Thank you.
You're welcome.
Bob, along those lines, was it considered, because there's a lot of talk over here in the eastern part of the state, that 11 o'clock game, or western part of the state, that 11 o'clock game next Friday, more than likely you're going to have a team from Western PA. It's going to be at least a 4-hour bus ride. They're with COVID, they don't want to come in Thanksgiving night, probably stay overnight. They would have to probably leave to be safe 4:35 in the morning. Is there any consideration for that? Was there ever any talk of maybe changing that for some of those teams, or is that for that game, or is that what you're just talking about right there?
That was one of the considerations. There's also considerations that some people have said, well, we want to drive in and drive out. So, yeah, Mike, we did take every possible consideration we could take into our decision making, but we also didn't want people to be playing late at that evening and having the opposite, driving home at 2 a.m. So it's a balancing act, and we're going to have to see where the teams come from based off the games this weekend. And yeah, somebody might have a 3-hour trip. And for an 11 o'clock game, that's a 7 o'clock departure time from the western part of the state, maybe even 6:30. As you well know, I travel often to Pittsburgh. And but again, where Bob Greenberg was alluding to, you also have a team from Erie. You also have a couple teams for outside of Erie. So we want to give them consideration as well. Anything else good for the order? If not, I won't bother you folks anymore. Our next board meeting will be the 9th. We did it that way intentionally to get it before the potential start of the winter sports season, so we could continue to monitor things as we go. I think the board has done a terrific job of taking a systematic process ever since we started this in August, and meeting more often to try to monitor things as they come up, and they need to be complimented on that, and I think you folks need to be complimented. One last thing for football next week. Folks, we're not trying to jam anybody up. However, Hershey has told us, I believe there's going to be very limited seats in the press box. There will not be any up top. There will be a limited number in the lower level. We are doing our best to take care of the stage area so you can work. If any of you would like to work from the stands, we'll do whatever accommodation we can. But the other part of it is we're also going to limit the number. If we've had groups in the past want 8 or 10 people come representing their company, we're going to ask those folks to reduce those numbers significantly so we can accommodate everyone. And we know if you have a team in from your area, we certainly want to give you any and all access. One thing that Hershey has told us, they are not inclined they will work with us, but they're not inclined to be providing food and drink. So if you do come in, please bring your own stuff. They don't want food service people out there dishing out food. So I say that as a heads up. It's not something as a criticism, that's something we don't want to do. We're just concerned about the spread, and we're taking every step we can along with the site recommendations to try to mitigate this the best we can. And we don't want to put any of you or us in harm's way. So with that, thank you all very much. Have a great Thanksgiving. And we'll look forward to hopefully seeing you next week, if not this week.
Thanks, Dr. Lombardi.
Thank you, Doctor.
Thanks, Bob.
Bye all.
Thanks, Bob.
Thanks,